Hello, my name is Foetal. Today's presentation is aimed at prospective parents to give them a full understanding of fetal development and monitoring and intervention. Pregnancy can last up to 42 weeks, which are broken down into 3 periods called trimesters. The first trimester, usually weeks 1 to 12, the second trimester, weeks 13 to 27, and the third, weeks 28 to birth. Today we will look at healthy development of the fetus and embryo, various monitoring tools, monitoring during labour and the impacts of it, abnormalities and screening processes, medical and surgical termination procedures, miscarriage and interventions. First, let's go over embryo and fetal development. At fertilisation, a sperm meets an egg to form a zygote. The zygote quickly divides as it travels down the fallopian tube to form blastocysts, which then implants into the uterus, roughly 6 to 10 days after conception. The blastocyst is made up of an outer trophoblast and an inner cell mass. The outer trophoblast develops into 2 layers that form the placenta, which connects the mother's blood supply and begins transferring nutrients and oxygen. The inner cell mass forms 3 germ layers, which give rise to different parts. These are the ectoderm for the skin and nervous system, the mesoderm for bones, muscles and blood vessels, and the endoderm for the digestive and respiratory tracts. Developing cells are now known as the embryo. In the embryonic stage, in the first trimester, critical organs and body system starts forming. By weeks 5, neural tube, the future brain and spinal cord forms, and the heart begins to beat. In week 6, limb buds appear, circulation begins, and early features of the eyes, ears and mouth start to form. Week 7 brings bone development, initial dental formation, and a large head with a small tail-like structure. By week 8, all major organs and systems are developing, web hands and feet are visible, and the umbilical cord is fully functioning. Fetal development. The fetal stage starts around 9 weeks and lasts up until birth. Growth and development continue throughout. Physical appearance. By week 12, your baby or fetus is now 5.4 centimeters long from head to bottom, which is about the size of a plum. By week 15, a fine layer of hair called lanuga starts to appear across the body. By week 16 to 20 weeks, the fetus grows rapidly from about 11.6 centimeters to 25.6 centimeters. Fingernails and unique fingerprints begin to form, and by week 20, the fetus is covered in a protective white substance known as vernix. This helps protect the skin from drying out. Between 21 and 25 weeks, the fetus continues to grow from about 26.7 centimeters to 84.6 centimeters in length. Eyebrows and more hair begin to develop, and the limbs gradually become more proportionate. Between 31 and 39 weeks of pregnancy, baby undergoes final stages of development. Between week 31 and 35, the vernix and lanuga begin to disappear, the head becomes more proportionate, and skin gradually smooths and turns pink. Fingernails and toenails reach the tips of fingers and toes. From weeks 37 to 39, baby gains fat and weight rapidly, making skin appear smoother and body looking plumper. And by week 39, they are fully developed, about 20 inches long, weighing 7 to 8 pounds, with only fine hair remaining on the arms and shoulders. Physiological development. Heart formation starts around about 3 weeks. Special cells in the developing baby gather and form 2 tubes, which soon combine to make a single simple heart tube. Not long after, this tube starts to beat and pump blood. Over the next few weeks, the heart tube bends and folds into an S shape, creating the beginnings of the left and right sides of the heart. And by week 7, the heart separates into 4 chambers, 2 upper atria and 2 lower ventricles. By week 10, the heart has all the major parts it needs and continues to grow and mature along with baby. During the second trimester, your baby's heart continues to mature and strengthen. In the second trimester, the heart chambers and valves are already formed but now grow and become more efficient at circulating blood. The heart muscle thickens. By the third trimester, the heart is practicing the rhythms and actions it will use outside the womb, and the muscles and tissues continue to grow, and the heart works in sync with the rest of the body to deliver oxygen and nutrient to all the tissues. The brain. During the embryonic stage, the brain begins as a neural plate that falls into a tube, which differentiates into the forebrain, midbrain and hindbrain. These regions subdivide and give rise to the brain's major structures as millions of neurons form and connect to body functions. During the second trimester, the brain starts to regulate vital reflexes, including steady movement of the chest and diaphragm. Reflexes for sucking and swallowing develop. Limb movements such as kicking and stretching become coordinated and are felt by the parent from around 16 weeks gestation. Around 18 weeks, the fetal nerves get wrapped in myelin, which speeds connections between nerve cells. By the end of this trimester, the brain stem is nearly mature, managing vital functions like heart rate and breathing, and the fetus can react to loud sounds. Between 26 to 28 weeks, the brain begins to show deep sleep cycles, including REM sleep. In the third trimester, fetal brain development accelerates dramatically. The brain roughly triples in weight, forming grooves and folds that create the classic wrinkled appearance. The cerebellum, essential for movement control, grows faster than any other brain region. And the cerebral cortex, crucial for thinking and memory, rapidly matures but does not fully function until birth. Bones. Fetal bone development begins during the 6th to 7th week of gestation through ossification. Intramembranous ossification form flat bones like those in the skull, and endochondral ossification forms long bones of the arms, legs, and other parts. The skeleton continues to grow and mature through the second trimester with rapid bone growth and increased movement. By weeks 21, fingers, toes, and joints are fully formed. And in the final trimester, increased calcium transfer helps with hardening of the bones, although much of the skeletal system remains cartilaginous at birth, especially at the growth rates, to allow for continuous growth during childhood. Sensory development. The sense of touch begins developing around 8 weeks of gestation, starting in areas of the face such as the lips and nose, and by 20 weeks skin receptors are in place. At roughly 8 weeks, the fetus's eyes start to develop enough to begin processing light, and by 16 weeks, light can actually pass through the skin and be sensed. The ability to hear starts to develop about 15 weeks, and from that point, the bass sound becomes clearer to your baby. By 25 weeks, baby can respond to familiar sounds like the pregnant pleasant voice and heartbeat. Smell and taste begin early too, with the palate and the tongue developing by 6 weeks, and taste receptors forming by 7. By 28 weeks, your baby can smell and taste amniotic fluid. Now let's take a look at monitoring. The role of ultrasound imaging. Ultrasound is a safe method to visualize your baby using ultrasound waves and is used to help confirm gestational age, detect multiple pregnancies, and monitor growth and placenta location. There are 2 main types. An external ultrasound. This involves a handheld device called a transducer moving over the body, the abdomen. It sends waves into the body. These waves bounce off internal organs and your baby, creating real-time grayscale images on display screen. Or an internal or transvaginal ultrasound. This involves inserting a thin transducer in the vagina to get clear images of the reproductive organs and early pregnancy structures. Internal ultrasounds can evaluate the size, shape and position of organs, blood flow, cervical length, fluid buildup, detect ectopic pregnancies and identify cysts. While not routinely used in pregnancies, internal ultrasounds provide more detailed views than when needed. Both methods are safe, painless, and help doctors monitor pregnancy and fetal development effectively. Doppler ultrasounds. A Doppler ultrasound is a non-invasive test to measure blood flow through blood vessels. The device can measure regular ultrasound, which bounces sound waves off objects, with a Doppler effect to determine the speed at which the object, in this case blood cells, are moving. A transducer sends sound waves through the body, either abdomen or vagina, which bounce back to form wave images on a monitor screen. Doppler ultrasounds have the ability to detect and assess blood flow in the umbilical cord, placenta, and fetal organs, as well as measure the heart beat and uterine contractions. Doppler scans are mainly recommended for high-risk pregnancies and are routinely performed on everyone. There are 3 types. A uterine artery Doppler. This scan checks blood flow through the uterine arteries supplying the womb, helping to see if the placenta can deliver through enough nutrients to the fetus. The scan is often suggested if there is a risk of poor blood flow or concerns about baby's growth. An umbilical artery Doppler scan. This measures the blood flow through the umbilical cord to the fetus. It is mainly done in the 3rd trimester if there are risks of fetal growth, for example, intrauterine growth restriction and preeclampsia. These conditions can signal reduced blood flow, and scans help identify pregnancies that need close monitoring. And a cardiotachograph, a specific form of Doppler which uses the sound only to retrieve information. It measures fetal heart rate and is mainly used during labour, especially if there are concerns or complications. Fundal height measurement. Fundal height measurement is a simple way to monitor fetal development through pregnancy. This measurement helps healthcare providers estimate fetal growth and position and track pregnancy progress. The fundal height is a distance between the top of the uterus, the fundus, and the pubic bone. The fundal height. To measure fundal height, the pregnant person lies back with an empty bladder and abdomen exposed. The top of the fundus is located by palpation. A measuring tape is placed from the fundus down to the pubic bone, and the length is read and measured and recorded onto a growth chart to track fetal progress. If it is typically measured in centimetres starting around 20 weeks of pregnancy and generally corresponds to the number of weeks gestation, give or take 2 centimetres. For example, at 32 weeks pregnant, the fundal height is usually 30 to 34 centimetres. If the fundal height is significantly smaller or larger than expected, further tests such as ultrasound may be recommended to check fetal growth and health. Monitoring during labour. During labour, parent and baby are monitored to ensure that they are safe and everything is going as it should. A midwife will examine the expecting parent to keep an eye on the heart rate, temperature, blood pressure, urination, water content, contractions and cervical dilation. Your baby's heartbeat will also be monitored, and this is done over 2 stages of labour. The first stage or the active stage of labour is when your cervix goes from 4 to 5 to fully dilated. Monitoring is done every 15 minutes. The second stage of labour is fully dilated to when your baby works its way down to the canal and born. Monitoring is done after every contraction. 2 key methods used to monitor are intermittent auscultation and continuous cardiotocography. Intermittent auscultation involves the midwife listening to the baby's heartbeat at regular intervals using a simple handheld device. They may use a Pinard stethoscope, a simple plastic or metal tool shaped like a traveler that the midwife places on the abdomen to listen to the baby's heartbeat, or a Doppler scanner, a small handheld device placed on the abdomen that uses sound waves to amplify the baby's heartbeat. Continuous cardiotography is a way to continuously record the baby's heartbeat over time, often over several hours, typically used for high-risk pregnancies. These risks include existing health issues like diabetes, early labour, previous cesarean section, multiple births, infection, changes in health during labour, or signs of fetal distress. There are 4 devices that are used. These include electronic fetal monitoring. This uses ultrasound waves to track your baby's heartbeat continuously during pregnancy and labour. A device called a transducer is placed on your belly, often secured with a belt. This device records the baby's heart rate and shows any contractions on the monitor. Telemetry is when a heart rate monitor device on the pregnant person is connected to a CTG. This machine tracks the baby's heartbeat and contractions. You can use fetal scalp electrode, where a small spiral-shaped wire is gently attached to the baby's scalp during labour. It is placed through the vagina and cervix after the water has broken. The electrodes connect to the monitor and provide a clear, continuous reading of a baby's heartbeat. It is often more accurate than external monitors. Or an intrauterine pressure catheter. A thin tube is gently placed inside the uterus during labour. Between the baby and the uterine wall, it measures the strength, length and time of the contractions more accurately to help midwives understand how well labour is progressing. IUPCs aren't used in every labour, but are helpful when more precise monitoring of contractions is needed. Why additional monitoring may be recommended. Additional monitoring may be recommended for several reasons. These include where you have pre-existing health conditions like diabetes or high blood pressure, as they may increase risks of during pregnancy and labour. Changes in heart rate, blood pressure or lack of oxygen, fetal distress. If the baby's heartbeat or oxygen supply shows signs of distress or problems. Fetal changes. Sometimes the baby's changes move to less ideal orientation, which may affect labour progress and safety. Having an epidural. Epidurals for pain relief can affect labour progress and mother's ability to feel contractions. And when there's a passing of fecal matter from the fetus meconium. If the baby passes through before birth, this can be a sign of stress. Where monitoring can lead to interventions or changes to birth plan. Monitoring is to ensure that both parent and baby are safe and birth plans go as wished. However, in some instances where there is developing high risk or signs of fetal distress, changes and interventions may be required and impact your birthing plan. This can include more or less freedom to move, possible changes in the type of delivery, possible medication preference changes, and possible changes to key individuals for support during labour. For example, in the case of premature labour, type of labour, monitoring preference and medication preferences may alter. Premature labour requires continuous cardiography, and it may be unlikely for expectant parent to have a water birth. Blood tests and urine tests will also be used to examine conditions of the expectant parent and baby to consider next options, which may include medication to assist baby's lungs for early birth. When monitoring shows there's fetal distress or lack of progression, intervention to emergency C-section may be required. Preferred delivery changes, and number of birthing partners also change to the limit allowed in surgical theatres. Another form of intervention that may be required is assisted delivery, where instruments can be used to help baby be born. There are two main types: a venturous instrument, where a vacuum cup is gently attached to the baby's head, and during contraction, the doctor or midwife carefully pulls the baby out using suction. Or forceps may be used, where a pair of metal tongs shaped to fit around baby's head is used to gently guide baby out during contractions. Procedure is safe and only done when necessary to protect both parent and baby, but does alter preferences. Monitoring texts are crucial as they help midwives and doctors keep a close watch on baby's well-being and decide if special care or interventions are needed. Now let's go over abnormalities and screening processes. A chromosomal abnormality is an extra, missing, or irregular piece of chromosomal DNA. Many inherited diseases and specific traits are results of chromosomal abnormalities or alterations. They include trisomy, where there are 3 copies of chromosome as opposed to 2. Common forms: Down syndrome, where the trisomy 21 is caused by additional chromosome of 21. Edwards syndrome, trisomy 18 caused by additional 18. Foetal syndrome, trisomy 13 is caused by an additional chromosome of 13. Screening process for trisomy. In the UK, between 10 to 14 weeks of pregnancy, a screening test called the combined test is offered to check for Down syndrome, Edwards syndrome, and Foetal syndrome. Pregnant people can choose which conditions to screen for, either 1 or 3 or none at all. The combined test includes an ultrasound and a blood test. The ultrasound measures the fluid at the back of the baby's neck, known as a nuchal translucency. A small amount of fluid is normal, but too much could signal an issue. The blood test checks for specific markers in the mother's blood that might suggest chromosomal condition. This combined information helps estimate the chance of baby having one of these conditions, but it does not give a definite diagnosis. If you are over 14 weeks pregnant, you'll be offered the quadruple test instead. This test is carried out between 14 to 20 weeks and the pregnancy and screens for Down syndrome, although it's less accurate than the combined test. If you decide to have 20 weeks down, it will also check for Edwards syndrome and Foetal syndrome. Further tests are available if initial screening show high chances. Advanced testing like non-invasive prenatal testing can be taken to further analyse fetal DNA from mother's blood. Again, these screening tests are not diagnostic tests, but merely an indicator to chance of trisomy in the fetus. All screening tests are optional. If screening tests show high chances, parents will be offered diagnostic tests. These include a chorionic villus sampling, where a sample of placental tissue is collected through a thin needle being inserted through the abdomen or vagina and then analysed. CBC is 99% accurate, but does carry a small miscarriage risk, around 1%. In rare cases where testing isn't possible for sample, an amniocentesis may be offered. An amniocentesis is usually carried out from 15 weeks onward once there's enough amniotic fluid. A needle is inserted through the abdomen to collect fluid containing fetal cells and then analysed. Amniocentesis is around 98 to 99% accurate, but does carry small miscarriage risk, about 1 in 150. The diagnostic tests are also optional. Hereditary diseases like sickle cell can also be screened for. Sickle cell is a serious inherited condition caused by change in the gene responsible for making hemoglobin. Instead of being round, affected cells become sickle-shaped, making them stiff and sticky. This can block blood flow and cause pain, anemia, and increased risk of infection. If left unmanaged, can have severe impacts on parent and baby in pregnancy. In the UK, screening is routinely offered via blood test, usually before 10 weeks. Testing is optional. If the parent present is a carrier, then the other biological parent can also be treated. If both are carriers, diagnostic tests can also be offered. Another abnormality includes fetal anemia. Fetal anemia happens when the baby does not have enough red blood cells while still in the womb. Red blood cells are important because they carry oxygen and nutrients. One common cause is a condition called isoimmunization, also known as rhesus disease. This happens when the mother's immune system sees the baby's red blood cells as foreign and starts attacking them. This usually occurs when the mother has a different blood type, Rh negative, from her baby, Rh positive. As the red blood cells are destroyed, the baby ends up with too few, causing anemia. The baby's heart then has to work harder to pump blood and deliver oxygen. In many cases, isoimmunization can be prevented. During routine pregnancy check, blood tests can pick up any risks early. If needed, a treatment called anti-D immunoglobulin can be given to the mother to stop her immune system from reacting to the baby's blood. The diagnosis process. Doctors can use several tests to check for anemia in unborn babies. Doppler scan can be used to scan how fast blood is flowing in the baby's brain. Maternal blood tests, routine blood tests to look for antibodies or signs the baby's blood may be under attack. Fetal blood sampling. A small sample of the baby blood is taken directly from the umbilical cord. This gives a clear picture of a baby's red blood cell levels, or an amniocentesis, where a sample is taken from the amniotic fluid is taken with a needle. It gives extra information about the baby's condition. Treatment. If the baby is found to have moderate or severe anemia, doctors may offer an intrauterine blood transfusion. A small amount of blood, usually O negative, is given to the baby directly into the umbilical cord. The procedure is usually safe but does carry some risks, such as miscarriage, 1 in 3 in every 100 cases, or early labour. We will now take a look at miscarriages and termination. Termination of pregnancy or abortion may be considered necessary in a variety of situations. These include health risks to the pregnant person, if continuing the pregnancy would seriously endanger the person with physical or mental health, or when there is severe fetal abnormalities, if a scan or test reveals the baby has serious medical conditions or abnormality that would lead to death before or shortly after birth, or when there's an unplanned pregnancy. In some cases, a person may choose to end a pregnancy due to personal, social, or financial circumstances, or when there's a pregnancy resulting from rape or abuse. If the pregnancy was a result of sexual violence, a termination may be requested. A pregnancy can be terminated by medical termination. Medical termination involves taking medication to end a pregnancy. It is usually offered up to 10 weeks gestation, but may be available later, depending on local guideline. A person needs to take a mifepristone. This pill blocks the hormone progesterone, which is needed to maintain a pregnancy, and then to take a misoprostol, taken 24 to 48 hours later. This medication causes the womb to contract and expel the pregnancy tissues. This method often feels like a heavy period and cramping and bleeding, and can take a few hours to a couple of days to complete. Another termination process is surgical termination. Surgical termination involves medical procedures to remove the pregnancy from the womb. It may be recommended for later pregnancies or when medical termination is not suitable. Options are vacuum aspirations, up to around 14 weeks, where gentle suction method is used to remove the pregnancy tissue under local or general anesthetic, or dilation and evacuation, usually after 14 weeks. It involves widening the cervix and using surgical tools to remove the pregnancy tissue, typically done under general anesthetic. Surgical methods are quick and recovery is often fast, although some cramping and bleeding is normal afterwards. Miscarriages. A miscarriage, also known as pregnancy loss, is when pregnancy ends on its own before 24 weeks. It's most common in the first 12 weeks, affecting 1 in 5 pregnancies. Often the cause is not known. When the reason can be found, it is usually due to issues with the baby's development or chromosomes. There are several factors that can raise the risk of miscarriage. Age plays a big role. Those over 30 have a higher chance, and by the age of 40, the risk may be as high as 50%. Other contributing factors include medical conditions, lifestyle choices such as smoking, drinking alcohol, vaping. Common misconceptions are that sex during pregnancy causes miscarriages. NCT notes that sex during pregnancy won't bring on labour or increase the risk of miscarriages where there are no complications. Another misconception is vaccine causes miscarriages. Preet notes that there is no clear evidence linking the vaccines to miscarriages. On the contrary, they provide more protection. How to reduce the risks. Avoid smoking during pregnancy. Don't consume alcohol or use recreational drugs while pregnant. Follow a nutritious, balanced diet. Take steps to protect yourself from infections like rubella. Stay away from foods that may cause food poisoning. And aim to reach a healthy weight before becoming pregnant. Signs of a miscarriage. In early pregnancy, possible signs of a miscarriage can include vaginal bleeding, unusual discharge, cramping pains, and a sudden loss of pregnancy symptoms like morning sickness. In later stages, warning signs may include reduced or no fetal movement and waters breaking unexpectedly. It is important to seek medical attention if you see any of these symptoms. If a miscarriage is confirmed, your healthcare provider will talk you through the next steps. If your body has already passed all the pregnancy tissue, no further treatment is required. If not, there are 3 main ways to manage a miscarriage. Expectant management, where you let the miscarriage happen naturally and can take up to 1 to 2 weeks. Medical management, using medication to help the body pass the remaining tissue. Or surgical management, having a procedure done to remove the tissues from the womb. Medical management involves the use of medication to help your body complete the miscarriage. Options include progesterone plus pessaries. These are inserted into the vagina and sometimes used to reduce miscarriage risk in early pregnancies. Or mifepristone and misoprostol, a combination of pills that help the womb contract and pass the tissue. Surgical management may be recommended if miscarriage is incomplete, bleeding is heavy, or other options are unsuitable. 2 common procedures are evacuation of retained products of conception, done under general anaesthetic, where a small tube is inserted into the womb so the cervix removes tissue, or a manual vacuum aspiration, a similar procedure done under local anaesthetic but using a gentle suction device. Experiencing a miscarriage can be emotionally overwhelming for individuals, partners and families. Some people may find comfort in seeking counselling or joining support groups to talk through their feelings, while others might need time away from work, studies or daily routines to process the experience. However, each person copes differently. Some prefer to return to their usual activities without seeking additional support, and that is valid too. Pregnancy is a life-changing journey, and understanding fetal development helps maintain well-being throughout. Throughout the process, monitoring methods such as ultrasound, fundal height measurement, and Doppler scans play vital roles in tracking baby's development and ensuring maternal well-being. Screening during pregnancy help identify potential risks, allowing individuals, partners, and healthcare providers to make informed decisions. Whilst miscarriage and termination occur, making well-informed decisions is important and must be met with non-judgmental, empathetic support to ensure both physical and emotional care. Thank you for listening to our presentation.